Hello, I'm Dr. Wickham Simonds. I'm an obesity medicine specialist in the Triangle area of North Carolina. This is Obesity Medicine Perspective, a video series that's meant to educate healthcare providers and patients on the disease of obesity and its treatment. The last time we did a video, we were talking about insulin. So in the beginning, we talked about the idea that obesity is an excess body fat condition. And I then led into the fact that the hormone that signals your body to store food as fat is insulin. So you want to keep a low insulin level, because if you have a high insulin level, you store your food as fat. And when you have excess fat, I told you to remember that your fat is an organ and it can become dysfunctional and it produces disease. So for those of you who may have cholesterol problems, high blood pressure problems, pre-diabetes or diabetes, inflammatory conditions of all kinds, this is all related to this high insulin level. That's the core unifying feature. So when we design diets and medication treatments, we're trying to not just help you lose weight, we want you to lose body fat. And our goal is not just to get your weight down, but to correct some of these conditions, or if you don't have them yet, to prophylax you against these conditions. So I want to talk a little bit today about what kind of diet can you do to lower your insulin level. Now, kind of the major concept to remember here is that when you eat fat and when you eat protein and when you eat most vegetables, these don't appreciably raise either your blood sugar or your insulin level. So a diet that consists of proteins, fats, and vegetables is going to keep your insulin level in check. And when the insulin level is not high, you can think of the high insulin level as a fat storage signal, but a low insulin level is a fat burning signal. So when you eliminate things that raise your insulin level and your diet consists of proteins, fats, and vegetables, you're going to burn a whole bunch more fat. Your body's going to operate in a completely different metabolic mode. And as a byproduct of that, the health problems associated with the high insulin level and obesity, such as the high cholesterol, the high blood pressure, the prediabetes, the diabetes, the inflammatory conditions, all of those things markedly improve and rapidly, even without a lot of weight loss initially. Just changing that diet is a very, very powerful tool. Now, the things that do raise your insulin level, and I think many of you probably know this: refined grains of all kinds, sugar in all of its forms, and starches. And so when we teach diet here, you'll find that we really teach a couple versions of carbohydrate restriction. And in place of the carbohydrates that we are restricting, we're putting in proteins, fats, and vegetables, and we're steering you in that direction. So the carbohydrates, it goes without saying, I'm assuming most of you know this, but I'll just hit on it just to make sure we got this concept right, is that when you eat those carbohydrates, your body can rapidly turn them to blood sugar. And to control the blood sugar, your body has to make a lot of insulin. So when we take those carbohydrates out of your diet, your insulin level has to come down because your blood sugar level comes down. The source of those kind of carbohydrates, when I say refined grains, I want to be specific. It's breads of all kinds, flour of all kinds, crackers, cereals, and it may even be stuff that's described to you as whole grain and has some other health redeeming qualities. But from an obesity standpoint, this absolutely sinks you, because even though it may have vitamins and fiber and all of this other stuff, it raises your insulin level, and this is a problem. So when we teach diet, we're going to steer you in the direction of proteins, fats, and vegetables. We give some very specific advice on how to do that, and the benefit is that your weight and body fat come down and that you get more healthy in the process. We can measure your body fat precisely using the InBody 770 to do a body composition analysis, and we are giving away some of these tests for free, and we want you to be a recipient of that gift. So to learn more about it, we want you to follow us on the Dr. Simonds Weight Loss Facebook page and our Twitter feed, and to continue following on this channel. We'll give instructions on Facebook and Twitter on how to register for that, and I feel certain that many of you, if you'll just go and bother to do that and register, you're going to find out that you're a winner and you get this test for free. Until next time, you give me the effort, I'll give you the tools, and together we can overcome obesity.